9. Stethoscope. Listening to the sounds that come from the chest offers very valuable and essential information for medical diagnosis. Healthy lungs do not sound the same as sick ones, and the same happens with the heart, the viscera, or the voice. In addition, each type of sound is associated with a disease, hence the importance of distinguishing them. Until the invention of the stethoscope or phonendoscope by the French doctor René Laennec, the usual method to hear these noises was to place your ear directly on the patient's chest, a rather embarrassing method when it came to women, and especially if they were obese. One day, Laennec watched some children scratch a wooden log with a pin at one end and listen to the noise from the other. He then had the idea of rolling up a piece of paper in the form of a tube, putting one end in the chest of a patient and the other in his ear, and found that he heard much better. The stethoscope was born in its most rudimentary version. Laennec perfected his creation, trying different materials and shapes, until he decided on a hollow wooden tube about 30 centimeters long and about 4 in diameter, with a drilled hole 6 millimeters wide. On one side of the chest, he wore a funnel-shaped piece and an adaptable earpiece on the other. It was disassembled in 3 parts to be able to transport it easily. Thanks to this invention, which may seem simple, it was possible to describe specific sounds that led him to diagnose diseases not known until then. Laennec was a conscientious scholar who, in order to verify the validity of his diagnoses, performed autopsies on patients previously examined by him once they died, mainly in cases of tuberculosis.